Hey, Dr. Lindsey and Lindy here. We're going to go through a case today that is a 3-stage flap repair. It's one of our most challenging cases we've done. This guy came over a few years ago with a history of having a jury flap done in the 1980s in Australia. And the first mistake he made was going to a plastic surgeon who'd never done one before. Never go to a guy doing his or girl doing their first operation unless you know that up front. And his second mistake was getting a jury flap. Back in the late 70s, early 80s, people came up with the crazy idea that doctors could elevate a flap of tissue containing the posterior branch of an artery coming up right here. And so you could lift up a whole big string of tissue and in one stage build a hairline. And the problems with it is that the hair back here is going this way, and so when you put it up top, it's going straight back, almost flush with your scalp. So it doesn't look natural, and it looks like a perfectly straight line. So this fell out of favor, but there's still, we still see a couple of people a year that have had those done, and generally don't want anything else done, but want something done to camouflage that. And so he had this jury flap done on his left side, and about 3 or 4 days out from his procedure, the distal half, meaning the half farthest away from it where it started, died. And it's probably because the blood vessel got kinked, or the doctor didn't take it wide enough to supply the flap. And so for the past 30 years, he's been walking around with a hairline that was too low on his forehead, with hair going the wrong direction, and 2 or 3 inches of funny-looking scar tissue over the central aspect of his forehead. And he became a hair cripple, and so he never took off his hat. His wife is a designer, right?
Yes, his wife. After the third case, he brought his wife in, and his wife was talking to us and said, now he goes to all these events with me. Before, he would not be able to go to the events because he will never take off his hat.
Right.
He was just embarrassed.
In a coat and tie, but wouldn't. I mean, you'll see in the picture. He looked odd, and I agree with his assessment that it was a terrible hair crippling event that he had. And so we came up with a strategy together that we did 3 operations. Step 1 is to do a strip case and build him a hairline where it ought to be, not down where the flap was placed by this plastic surgeon. But we put it up about where mine is, where the skull goes from vertical to horizontal, and we made the typical curve with a few irregularities out in front so it didn't look abnormal. And he's got the limitation of fairly fine hair, but step 1, we got him a hairline and a coverage of his frontal, 25% of his head. And then roughly 10 months later, he came back and we cut out his flap containing some hair, which we took just like it was a strip and used those hairs to work behind his first case. And then we cut out the scar and then did a reverse brow lift where we pulled the hairline forward and sewed it up and got a nice little linear scar. And didn't his wife take out these stitches? He flew back to England.
Yeah. She we FaceTime while she was removing them.
Yeah, so after that we do it today and we see it tomorrow for these hairline advancements. And then there's really nothing to do for a week until your stitches come out. So he flew back to England and his wife took out his stitches, and you look pretty good after this. It's just a little bit of swelling. Wear a tennis headband for a couple of days. And so then, even after we got rid of that funny looking flap and his scar tissue and got him a hairline, these guys who have had trouble before are still so scared that it's not going to turn out for them, right?
Yes, I get 3 or 4 calls in a day, and they tell me, I had a hair transplant, it didn't work, or they tell me the story, and then they have all these questions, and they call me for a year with different questions. They're still doing the research. They're afraid to move forward with anything because they don't want to go through what they went, and they don't want to make a mistake anymore. I think they realize, oh, I really need to know what I'm doing. Yeah.
So at about 10 months out from his second case, then when it's starting to work and you realize that we didn't scam him and he now looks normal, then he starts going out in public. He starts looking better, and then we can't get him to quit hassling us about, let's do the third step.
Yeah, he called and he's like, can I do my procedure after the 6 months? I was like, no, you have to wait until
we got to wait until the blood supply grows back through the scar that we made up here and his scalp stretches enough that we can do a safe job. And so he came back and we did his third procedure, which was a second strip hair case, which we augmented his hairline with some singles and then worked behind his previous work. And then he turned out great. And I think even before he fully grown in, his wife said...
Yeah, she called in and she's like, now he wants to go to different events. Now I'm feeling... She said that now she's feeling like she needs to get something done. And he told her that you might be...
Yeah, so she flew over and we did a facelift on her, and they did their first vacation. We did a facelift, and they stayed around a couple of days, and then they went to Cancun, right? Yes.
She said that Cancun was the best place because he hadn't gone anywhere near the water where he had to remove his hat.
Right. and he could go jump in the ocean.
Yes.
So this was life-changing for him and really a lot of fun for Wendy and me.
Yes.
So I wish we could get him back, or if he came through the U.S., we could get him back and have a talk with him at this point. So. Yes,
because the last pictures that we have, he's not fully grown on his third case.
Right.
But he was over the moon already by then.
Right. So there'll be a little clip of him where he tells you what his experience was. So enjoy. Thanks. All right. So I'm going to ask you a couple questions. So can you briefly describe what we did for you and what happened to you before you met us?
Well, in 1985, I was 23, 24, losing my hair. Sort of lived in Australia. Went on online in the Yellow Pages, actually. Sort of just picked out this surgeon in Brisbane. Went in there and he suggested that he could sort of do something about my hair loss. He did a flap. What do you call it?
A jury flap, probably back in those days.
Yeah, did a it got infected. It all fell out. 3/4 of it sort of like grew back, and a quarter of it sort of died off, and I was left with this horrendous scar. So which affected my life, and it affected my sort of like social life. Sort of just wore a hat most of the time. I wouldn't go out at night as I felt too embarrassed about it. People were looking at it. And I thought, oh well, I'll just live with it. And then the rave was that more guys were sort of like getting sort of like transplants. So I went on the internet and sort of like to Lindsey, and it was full steam ahead really. So I've been coming back. I've had 3 procedures.
Our first one, remember we did a transplant to build you a hairline, right?
That's right.
And then like a year later, we took out your flap and pulled your hairline down and used those hairs behind the first hairline. And then our third case, I think, was to augment your hairline. You're about 7 months out from that one.
That's right. And I can't express with words really how happy I am with it. It's changed my life completely. I don't feel embarrassed going out anymore. I don't get looks, you know, up in that area. So yeah, I couldn't be more happy really. I've just come over. My wife has just come over for just a small procedure, so we've just sort of like just hanging out here, and I thought, why not? It's a great idea to sort of like promote this. That if anyone sort of feels like, you know, they're sort of a bit down and out about their hair, I would recommend sort of catching up with Dr. Lindsey, just having a chat. There's no pressure. So,
all right, well, thank you for the endorsement. Thank you. So, hope you enjoy this video. If we can help you, give us a call.